we have discussed about 10 major domains of cognitive function are impaired in substance use disorder. And we discussed how we might be able to give people an idea about how these things are impaired and how they might be able to find ways to improve those functions or use them in the right way in the process of recovery. Okay? And then we are going to add few other trainings or advices for the process of recovery. Things like that you need to be committed for the process of abstinence, try to avoid cues that are related to the abstinence, to the relapse, and some other specific advices. Things like be more patient and hopeful, specific kind of motivating messages for the process of recovery. So we technically have these three major domains, talking about the brain functions that are involved, games with them, and then specific brain exercises for the daily life, and then specific advices for the process of recovery. Okay, and we have them together as three posters for these three major lines of kind of activities. And we have them in a book that is called Brain Healing First Aid, that you see that. And we have divided all the things that we had today in 4 parts. And these 4 parts are basically 4 sessions. So we run the therapy sessions in 4 separate sessions. And I tell you how we divided the material in these 4 sessions. So session 1 is mainly about attention and memory. Session 2 is about interoception, feeling bad, sleep and arousal. Session 3, decision making and movement. And session 4, awareness, insight, social cognition, and feeling good. Okay, this is how we divided these 4 sessions in 4 parts. These kind of 10 domains in 4 sessions. Okay, yes. The sessions are supposed to be 90 minutes. The sessions are supposed to be 90 minutes. They are supposed to be in a group-based setting with 8 to 12 subjects. We have done that with 60 minutes of each session and up to 15 patients. But I can tell you it would be really hard to cover the material for that amount of time. So it was really, we had really hard time to be able to cover material in 60 minutes. And it would be hard when you get patients more than 10, 12, 13 patients, because they need to kind of give feedback. So it makes things a little bit complex, especially when you have people who are pretty much engaged and motivated to be a part of the discussions, and you receive lots of feedback. You can see that when you discuss about these deficits, about attention, memory, they would start to kind of share lots of personal experiences, and that would take time. So it's really important to be conscious about the timing. So one of the major challenges in running these sessions is just getting sure that you engage people, but meanwhile you manage the time in a way that being able to cover the material in one entire session. So that is how we try to put things together in 4 sessions.
And that's always a challenge.
That is always a challenge, yeah. Especially when it's... I prefer to be even skipping some of the parts, but make people more engaged, to be honest. So there are occasions that I even skip some of the exercises, but I really like to keep people engaged. So if they still have comments, if they still have questions, I prefer to answer questions and make them engaged, other than just getting sure I've done all the exercises in one session. So I really like them to be involved and be a part of the discussion. So I think it's going to be more important and more effective in long term if they just feel that it's something about. So it's not just about check marking that I've done all the exercises, that I've covered all the material till the end. It's important to say that, okay, we have discussed about that actively in 90 minutes, and then they will have time to go through the other exercises that left over for the home, and they can read those materials if they feel that it's something about them. It's something that is engaging for them. So it's really, really important to manage time in a way to get sure they are really engaged. So what is the general tone that we have in these 4 sessions? So you can imagine it's a really 4 sessions. So it's really short intervention. It's really short intervention. So it's a really brief intervention. You need to have a sense about what is the tone of the therapist in these sessions. It's really important that we are talking about awareness. So as you can see here, we are talking about how people could be aware about what is happening inside the brain. So awareness is a really important part of the package. The second part is about hope. So we give them a sense about, okay, these are the deficits that you have, but there is a significant hope. Because it is exactly like your muscles, that if you invest on them, if you spend time, if you train them, they can get better. So the hope is a really important part of this training. So from the first step, we just want to tell them, okay, there is a significant hope for recovery. And hope and awareness would provide them with a specific level of motivation, because you give them a sense, okay, these are the deficits that you have, there is a hope for recovery, and this is a roadmap for you to move forward and help yourself in the process of recovery. So you provide them with a sort of roadmap for recovery. So you give them an idea about what are the things that could be happening in the future if they get engaged in these trainings. So you extend their future time horizons, talking about, okay, when you go to a gym, you're not expecting to have better cardiovascular system or better cardiovascular fitness or better muscular fitness with just one session or two sessions. But you know if you go to a gym for 6 months, you would be a totally different person. So you know that if you get engaged in the process of recovery, in 6 months, in 1 year, you would be a totally different person. So you are providing them with awareness, hope, motivation, and provide them with a roadmap. Okay, if you are interested, if you have a hope for recovery, now you have the motivation, now you know what to do, this is the way that you should go. So you cannot do more than this in 4 sessions. Basically, give them a hope and give them a map that, okay, this is how you are going to follow the process of recovery. And this basically gives them a level of self-efficacy, a feeling that, okay, you can do something for yourself. If you have the hope, now you are motivated, now you know what to do, now you know it's going to happen not today, but in long term if you invest on that, then they feel that, okay, I'm in charge. So if I do something for myself, I would be a totally different person in the future. Okay? And meanwhile, in the therapy sessions, they have a sense of support in the community. So they would start to realize that if they have attention deficit, it is not just them that they have deficits. There are others in the therapy session that have the same deficits. There are others who are suffering from memory deficits. There are others who are not in control. There are others that they have a bad feeling. And then they feel like, okay, it's not just me that I have these problems. And they have a feeling that, okay, it seems that there are others who have the same problems. And they feel they will have a sense of support. And that support could be from their therapist, or it could be from the peer group that are providing feedbacks to them in the therapy session. And it would reduce the amount of stigma and negative valence that we have for these deficits. So they feel that, okay, this is the normal process of recovery. If I have attention deficit, if I'm not in control, if I feel bad, this is something that is usual among others as well. And if I do the right things, if I empower my brain muscles, over time, they could get better. So then they would not have a negative feeling about sharing those things. Because one of the challenges that we have, one of the concerns that we have, sometimes when we provide them with awareness, they just feel overwhelmed with realizing that they have many deficits. And that is one of the concerns they have when you provide them with information. The final outcome of the first session is not about telling them that your attention and memory is a mess. So it is not the outcome of the first session. So you are not just going to tell them that, okay, now you are getting aware that there are lots of really bad things happening inside your brain. It is not the message. So it is really important for us to get sure that we are taking away the stigma from these deficits and telling them that, okay, you know that is a really great move forward. So you are aware and you have an insight about the deficits that you have, and there are significant hopes that you can make them better. And if you make them better, your life would be a totally different situation. Okay? So this combination is going to be important. What was your question?
Can you frame it also in a way that goes with, like ADHD also have a lot of gifts? I mean, if you notice that a lot of famous and very successful entrepreneurs are ADHD, kind of start with that, or?
It's also important not to normalize that in a way that would reduce the amount of motivation for them to change.
Got it.
So you need to be careful how to make a good balance to say that, okay, this is something that's going to be important. You have this deficit. People are different in terms of the deficits that they have. You can make that better. Meanwhile, it's not something usual that everybody is feeling bad. So it is okay to have it's not to normalize that to a level that would be problematic as well. And meanwhile, it's also important for you to provide them with a sense that, okay, my attention is not working, so that is the reason that my life is a mess. And when they go home, they say, okay, the reason that I cannot work is that I do not have any good attention. So that's it. So I'm a kind of sick person. I'm not able to do anything. So they would take something like a sick role. I've seen that when you use that specific, even ADHD label for students, they take that label and say, whenever they cannot kind of manage something, they say, okay, I have ADHD. That's the reason I cannot pay attention enough to my homeworks. And they do not have even hope. Okay, you have ADHD, but you can train that in a better. So it's not just about putting a label on somebody and say that, okay, you have ADHD, and that's it. Okay, this is the style that you have. So you are supposed to not to pay attention. And that's the problem that I've seen, that people would receive a label, and in entire life, they do not pay attention to different things, and they just say that, okay, I have ADHD, so I cannot pay attention.
Maybe going back to what you were saying, instead of framing it like, oh, these people have ADHD and they became successful, they didn't become successful because of the ADHD. They became successful in spite of the ADHD, and they learned how to manage the condition. And that's what this curriculum is trying to do too.
They had that awareness.
Yeah.
Exactly.
And they understood that they had to manage and overcome. Right?
Exactly. Yes, please.
I use a nice metaphor for this with people sometimes. When some people have come in with like a baseline issue with attention, that everybody has, everyone's probably heard this before to some extent, but everybody has a different rubber band. So some people who have more difficulties with attention might have a smaller rubber band, but what we can do is we can train and we can stretch it out. You might not get as far as some other people in terms of stretching it out, but what we can do is do some things to help stretch that rubber band out.
Exactly.
That's good.
And you receive lots of, when you put the tone in the right way, you receive lots of same type of feedbacks from people, and that is really helpful. When you have a group of people around the table, you have a really interesting dynamism between them, and that is always helpful in the discussions that we have in the group. Yes?
Is the program usually used in conjunction with like another program? Like, could they do 12-step and this as well?
Whatever we are talking today are going to be just adjunct to the treatment as usual that people are receiving. Okay. And the good thing about the trainings that we have here, they do not have any interference with what people are receiving right now in the process of recovery. And even those who have been in recovery for a long time, for 1 year, 2 years, or they have been in different centers, they receive lots of different things, I've never seen any single patient that would say that, okay, I knew all the things that you have been discussing today about. So the material that we are providing is unique enough that even those who have been in many other recovery centers for 10 years before, in many kind of different states, when you start to talk about those things, they will find them novel enough to get engaged. And that is good. So, and then meanwhile, you would not receive kind of negative feedback from other colleagues that you are interfering with what they are. I've received feedback from colleagues that when we have, let's say, CBT sessions, now people are talking about the terms that we have not been discussing about before. So they are talking about attention. So they say that, okay, this is the reason that I do not have the control. So they use the term that you are training them in other therapy sessions, and that's interesting. So I receive positive feedbacks from others that people are kind of even more involved in the process of therapies that we have been providing, because now they feel that, okay, what we are doing is more meaningful to them. So they feel that, okay, these are the things that are going to help my brain in the process of recovery. Okay. The other thing that might be important is, as I told you, it's important to manage the exercises in a way that people would not lose their feeling about their efficacy in the session, feeling that, okay, these exercises are too complex for me, I'm really messed up, I cannot follow what is happening inside the class, so I'm already done. So my brain is something like egg on kind of frying pan, and it's done. So you're not going to kind of provide people with that sense. Being concerned about how people are comparing themselves with others, it's really important to compare people with themselves, not to compare them with others. And it's also important to kind of getting sure that you would not develop avoidance among people for these exercises, feeling that, okay, they're not really good in those exercises. Meanwhile, as you know, that most of the kind of psychotherapies in drug addiction are about one step at a time. You are supposed to think about being sober for today. Sometimes when you extend their future time horizons, that might get a little bit scary for them. So when you start to talk about, okay, you can get better, your brain function would be better, so you can go to school, you can get your college degree. When you start to extend their time horizons, it might get a little bit kind of uncomfortable for them. So you need to get sure how to manage that in a way that not to extend their future time horizons in a way that would make them uncomfortable. And it's a really delicate kind of experience and expertise to be able to manage the group session in a way that sometimes even for group of people, you can even extend their future time horizons to the next, let's say, 25 years, discussing about, okay, you are like now 25 years old, what do you like to be at the age of 50 years old? So you can kind of do this sort of kind of expansion in their future time horizons. But there are people who you cannot do that. So you need to be careful how much you're extending their future time horizons, not to make a problem for them. So that's also an important issue. So as you are in the workshop, we had kind of several workshops training people who are basically providing these therapy sessions, and this is one of the sample kind of group settings that we have been using with the material. So you can see that we had the posters, the booklets. In the first rounds, we have been using mainly the printed material, the white and black and white printed material. But right now, we are using the booklets that you can see. We have published a book chapter about neuroscience informed psychoeducation. Those who are interested to know more about the concept, the basics, how we design the material, that would be something that would be helpful. And we have done different workshops, and those workshops are recorded and are available. So most of the time we cover something in each specific workshop, so you can, when you go to see the previous workshops, you have a kind of a sense about kind of different aspects that could be kind of joined together and give you a better sense about what we are providing, okay? And we have a web page. In the web page, you can find a different. So we had a workshop in New Zealand a few months ago, I mean, in different places. So you can find those kind of educational workshops there. Right now, the website is down because we had to receive copyright for the material, and if you publish the material on the kind of website, you cannot receive the copyright. So we put the kind of website down for a few days. We will bring it up again, but I will send you the details. I have a YouTube channel. You can find them on my YouTube channel. The problem is that in my YouTube channel, I have many other things that you might just get lost in. I have kind of fMRI workshop classes and kind of brain imaging classes. There are.
You don't have it organized in folders?
I tried to do that, but even because I have something like 12 different folders, and so yeah, it's a little bit kind of complex to find them. But you can find them if you search them in YouTube. The materials that we are talking about right now are being translated in 12 different languages. So we have them in other languages. Those who have clients in other languages, they can use material in other languages, especially in the places that they have people with different languages. I received the feedback from people in Israel that they have clients in different languages and they use the material because we have them in many different languages. So they can use them in English, they can use them in Arabic, they can use them in Hebrew, they can use them in German. So they can use them in different languages, even within one single session. So that seems interesting that people can use them in all different languages. And all these languages, especially the posters, are available online in our webpage. So you can basically download them.
Is that off your website?
Yes. Yes. They're on the website. So you can find them in Chinese, Swedish, Hindi, Italian, German, so other languages. Okay. So this is one part. So I'm going to kind of go beyond that and discuss a few other things that we have. And also, I'm going to go through the sessions together to give you a better sense about how you are going to run the other things. But now we are almost in the middle of what I was supposed to discuss about. So any questions so far? Okay, good. So what we are discussing today is about a 4-session, really handy, small, brief intervention, okay? But we realized that after doing these 4 sessions, people would say, okay, that was great. What will be the next? How can we now be trained for the next steps? So we developed another intervention we called Neurocognitive Empowerment for Addiction Treatment, or NEAT. So we have NIPE, now it's NEAT. And NEAT is, we call that brain gym. Brain gym for recovery. And it has, the first version had 16 sessions. Now it has 14 sessions. We cut it down because of the limitation in the time, the trial that we had. But it has 16 sessions. So you can see that we start from attention, negative valence, attentional bias, positive valence, interoception, response inhibition. We have a review session, and then memory learning, effective memory, prospective memory, flexibility, problem solving, decision making, another review, and then the conclusion. So that is the structure of 16 sessions for brain gym. The architecture is designed to be hierarchical. So we start from basic cognitive functions, from sustained attention and working memory, and eventually we add things to that. So we add flexible attention in the session 3. We add interoception attention, negative attention, positive attention, inhibitory control, and then we have a review session. So this is how we still have the sustained attention training here, but we expand that with more complex cognitive functions. So we call that hierarchical cognitive architecture for the package. Then we basically add memory. So the first half is mainly focused to attention. So attention is so important for us. And there are many potentials for training attention, that something like at least 1/3 of the package is about different sort of attention training and how you might be able to train your attention. And then the second half, we have the first part about memory. And deficits that they have in memory, and memories that are related to drugs and how they might be able to modify those memories, and then how they can make new memories for the future. So we talk about declarative memory, memories related to negative events and drugs, and then prospective memory. So we basically add emotional memory, and then we add prospective memory, executive control. Then we start to discuss about how to do problem solving with episodic future thinking and self-monitoring, and review 2 and conclusion. So that is the design that we have. I will send you a link to the slides. So those who like to have the material on the slides, I will share the slides with you. So this is the design that we have. So we have pages with the same idea, but they are more comprehensive. So you can imagine that when we have just one session on attention, that would make things more comprehensive. So this is the package that we have, Brain Gym, and it has 14 sessions. So the package,
14 sessions and 4 sessions.
this is the 4 session, this is the 14 session. So people do that this and then this. I mean, that's another level, okay? So each session would have one booklet. And then in the first half, there are materials that we cover in the class. And in the second half, there are materials that are for homework. So it's not just about the class, also about homework. So the NIPE package, the brain healing package, is just about the class. So we do not provide them with many things about the homework. But the second one is more, I mean, they need to go to a higher level of commitment. And they are supposed to do homeworks as well. So it gets more, let's say, they need to have a high level of commitment, investment. Yeah, they need to have a high level of investment for that. And I'm just going to give you kind of few examples to just get one of those to have a sense about how do they work. And we have designed all the games and cartoons in-house from scratch. So we have not adapted anything from outside. So everything is basically home-cooked. And so I have a few others for those who have not received. Oh, sorry. Oh, there you go. The other thing that we have in the Brain Gym package, we have what we call Brain Planner. So we give them a Brain Planner from the first session, and they are supposed to monitor what they are doing in the entire week in the planner. So every week they are supposed to write down whatever they have. And the other thing that we do, we give them, every session we bring a box of colorful pens. And they receive one pen, they can pick up their pen. And when they do their homeworks in the best possible way, the best people will receive basically the kind of incentives by just receiving one additional pen. So over the time they have more pens in different colors. And usually they use those colorful pens to make up their basically brain planners. And there are people who are using really, really nice skills to kind of fill up the planners. I've seen many patients that they told me that it is the first time in their entire life that they have used any sort of planner. So being exposed to be able to use and having the skills to be able to use planners is something really interesting that we have. And there are patients that are really bad in, or they do not have any, do not make any investment to make planners. So you can see different variations of people in the session. So that is the package that we have that is more comprehensive and is more I mean, it needs a high level of commitment. But we saw people that there are, I mean, people, right now we are running that in a alternative to punishment program, which is for women in Tulsa who are supposed to go to jail, and instead they are offered a kind of something like 1-year treatment. So they are in the sort of intensive outpatient program, but they have some legal obligation to attend the classes. They are happy to give up some other sessions, but come to the brain gym session. So it's really, and it's, even we have kind of long waiting list of people who are waiting to kind of get into the brain gym session. So it's received really well. So people really like the sessions, and they really like to join. So if I want to give you a short tour, you can see that it has more kind of details. So it has education, it has brain concepts. As you can see here, there are specific games. Under each game, we have some specific tips about, okay, what does this game mean? What are the brain functions that are involved in that specific game? So there are specific brain boxes under each game talking about how these different games are going to be helpful for the process of recovery. So you can see it's pretty much comprehensive in terms of the material that we have inside. The model that we have to use this material, so we have posters, we have NIPE package, we have the NEAT package. Okay. We usually say that the posters could even be used before the initiation of recovery. So people can mount the posters in the treatment centers, or even we had the experience of mounting these posters in general hospitals, in the places that people who might suffer from substance abuse just pass over and see, okay, it seems that there are hopes for the process of recovery, and then they can get engaged in the treatment. So even people might be interested to mount these material in places that are not basically recovery centers. It could be mounted in places that are kind of general hospitals, just giving people information about, okay, especially the poster 1, which is about the deficits that people would suffer from substance use. And that could be a motivation for them to get involved in the process of recovery. Okay, so they could be used for the pre-recovery. We can use the brain healing for the early recovery, and then need for the kind of longer recovery. And based on their setting, if it is in the residential setting, or if it is in the hospitalized setting, or if it is in the office-based setting, people need to define how they are going to use this material in different settings. What is the timing? And then we have another brain gym book that those who basically finish the brain gym for recovery, we provide them with the extended brain gym. That has another 16 sessions of training on the top of what we are providing. Because I think that if we are going to be successful in addiction treatment, the treatment is supposed to be long-term.
That's homework.
Exactly. And I think that the 2 most successful treatments that we already have for addiction is basically the 12 steps program and methadone maintenance programs. I think that these 2 programs are the most successful programs, and both of them are long-term. So when you get involved in something like an NA or AA program, it's for your entire life. So you have supports for at least several years. And that is the reason that the program is so successful in long term. This is also true for methadone, because we provide methadone for a long period of time. I have patients that are on methadone for 5-10 years, and they're doing really well. So how you can basically bring something that is not just for a few months, it's something that, and we believe that after doing these kind of steps in brain gym, after receiving those exercises, then we kind of guide them to have these materials so there are books, other materials about brain, so they can have these materials. And we also try to see how we can have self-help meetings, those who are doing these puzzles and games together and discuss about this. So we think that if it is going to work, we need to have a supporting community in long term. And that is the way that we think that it's going to work if it is going to be effective in long term. The other thing that we are doing right now, we are developing a web-based version of Brain Gym, because right now we receive lots of feedbacks from. Let me just give you an idea about what's happening right now in Tulsa. In Tulsa, people get into a hospital. They would be in hospital for, let's say, 1 week, 2 weeks for the detox period. Then they go for an intensive outpatient program for a few weeks. And then they go to Oxford houses or other residential treatment centers or other, let's say, transitional living places. Okay, that is the process. Recovery houses, okay. Or from the first day they go to a residential center, they would be there for 1 month or up to 2 months. And from there they go to the transitional living places or recovery houses. Okay. When they go to the recovery houses, in the recovery house they are supposed to work. They are supposed to make money because they need to pay rent, they need to pay. And they get too busy to be able to receive anything more than just one meeting, one NA meeting or A meeting per week. So we realized it would be really hard to have patients for the training sessions. Even they are motivated, they want to come. Some of them, they have a kind of job in the morning. Some of them have job in the afternoon. Some of them work in the restaurant, so they cannot come because they work from something like 4 p.m. to 9 p.m. So it would be really hard to find a time that people can get together. So we realized that we need to have a platform that people who would not be just in the town of Tulsa, they go across the state of Oklahoma. We can give them basically 2 tablets, 2 really simple tablets, okay? And these 2 tablets are being used in a way that we use 1 tablet in front of them, so they have 1 screen in front of them. This is the screen that they have in front of them. And then they have another tablet on their lap. So they do the exercises on the tablet that they have over the desk or over their lap, and they communicate with the therapist and other people who are in the therapy sessions with the tablet that they have in front of them. So that is the model that we have. And they do the exercises here, they communicate with people, they receive some educations here. And there is a way that we give them feedback based on their performance in the previous games that they have done. So this is not, they do not receive any feedback comparing them with others. So they are being compared with themselves. That is the model they have. There is another kind of interface that is for the therapist. The therapist would receive the feedback from all the kind of the people that they are attending. So he or she would be able to see what is the performance of different people in the group, even see the performance in something like a histogram, seeing that, okay, how people are performing compared to each other. But each individual person would not receive a feedback regarding what is their status in the group. So they receive the feedback based on their own personal performance. So that is the way that we design. So this is the way that we are kind of arranging that, and we are thinking how we might be able to basically design that. And Nikki is working on that specific kind of platform. So we are right now kind of putting different pieces together to see how we can make this happen, to have kind of different details inside. So this one is basically working with the, let's say, pen, and people can use a pen. So that is the other level that we are thinking about that. And in this level, we are making something like a community of those who have attended these classes, and they can receive exercises on the tablet for a long period of time. And they are supposed to do their homework, so that the therapist would give them a specific homework that they are supposed to do, and they come back. So it is not just something like an online therapy session that do not have communication with anybody. You still have the communication. You interact with people. You have games to do that would be engaging as well. So it would be a combination of different things that we have, and we think that it's going to work. So, and we receive lots of really positive feedbacks from presenting the idea to some of the people who are in the kind of recovery houses. It seems that they are going to support us for that as well. So that is the next step that we are going to do. Those who are interested to learn more about what we do for the cognitive rehabilitation, there are some other materials in terms of how we add neurocognitive rehabilitation as something like adjunct treatment for addiction and addictive disorders to help them in the process of recovery. There is another book chapter that we wrote about, in a kind of a general sense, about neuropsychological rehabilitation for different psychiatric disorders. That is a part of a kind of famous neuropsychological rehabilitation textbook that has different chapters. One chapter is about neuropsychological rehabilitation for psychiatric disorders, and including substance use disorder. Okay, as I told you, especially with the brain gym, we receive lots of feedbacks that, okay, how can we have a copy for our kids? Because we think it's going to be helpful for them as well. So right now we are revising the package that we have to have that for kids who are in the high school. So that's kind of the age group that we are targeting. How we can provide these trainings for people in the high school. And the idea is, if we target these executive control functions, attention control, memory management, emotion regulation, interoceptive perception, cognitive flexibility, those functions, we can help them to develop a cognitive resilience that would end up with better mental well-being, social competencies, adaptive behavior, academic achievement. So that's kind of the idea that we have. We think that if we target these kind of brain functions, train these brain functions, they would eventually end up to adaptive behaviors in the society. That is the idea that we have. And in that package, we are also adding some other educational material about prevention for substance use and how drug would make a change inside the brain based on the terminologies that we are discussing today in terms of attention, memory, all those deficits. So these are basically additional cartoons that we are adding to that, discussing about prevention as well.